Diabetes can affect your life in a way that will bring a lot of problems to you. Now, diabetes is a major factor for stroke, okay, and taking it lightly will not only give somebody stroke, but it can lead from severe disability even to death. Okay, and diabetes does not just affect your blood sugar; it's also a major factor for heart diseases, strokes that will affect, and a lot of complications. Okay, that will affect the quality of your life. In today's video, we'll be talking about how diabetes can increase the risk of getting a stroke, okay, and the reason behind these connections, okay, and then if and most importantly, actionable steps you can take, okay, actionable steps you can take to reduce this risk, okay, and if you or somebody you know is living with diabetes, I'm sure this video will be a life-changing one for you. Now let's dive in. Diabetes occurs, okay, when your body cannot properly process food due to problem with insulin, or your body doesn't produce enough insulin. You get that? Now, or it can be insulin, or it can't use insulin effectively. You know, when your body can't use insulin effectively, you know, this causes your blood sugar to build up in the blood, okay, and leading to high blood sugar. All right, now, and when it increases, when the high blood sugar increases, okay, it damages your blood vessels throughout your body, okay, and then including it damages your blood vessels, including that of the brain, okay, which increases the risk of stroke. All right, statistics shows that adults with diabetes are twice as likely to die of heart diseases or stroke compared to those without diabetes. Okay, and people with diabetes often faces other contributing factors such as one, extra body weight. Now, extra body weight here puts a lot of stress on the blood vessel. You know, people gain a lot of weight, they feel it's evidence of good living, okay, and they eat anything, they eat late. You know, there are times you eat some certain kind of food and there are times you don't eat some kind of foods, okay. So but gaining excessive weight, okay, can actually affect your body and increases the risk of stroke or heart diseases, okay. And people with excessive weight, okay, they are always having this kind of issues. Many of them actually have this kind of issues, okay, and they don't actually take care of it because they believe it's evidence of good living, okay. Now, two, high blood pressure. High blood pressure is actually one of the, in fact, the leading cause of stroke. Yes, high blood pressure. Now, people have a lot of these issues, and it's amazing that people don't even bother to check their BPs until maybe they are sick or they have some symptoms of malaria. You know, they want to go to the hospital for checkups. You know, high blood pressure can attack anybody within minutes. To this minute today is okay. Within some few minutes, it increases. Okay, so it's advisable for everyone to have high blood pressure monitors at home. Okay, when you have high blood pressure monitor, as in blood pressure monitor at home, you can constantly monitor your BP. Some people say in our family we don't have this, in our family we don't have it. I know BP problem can actually be hereditary at times, but sometimes due to what we do, due to what we eat, what we think, you know, we can build up these things, high blood pressure, and can create a lot of problems. So let's endeavor to always monitor our blood pressures. Good. Now, number three, high cholesterol, which contribute to plaques, okay, or plaques build up in the arteries. Many a times our arteries, when there are plaques around the arteries, okay, the arteries is the oxygenated blood pass through to the brain. Now, if this oxygenated blood doesn't pass freely, it begins to create a lot of problems, okay. Now, this problem around of arteries being blocked is one of the major factors leading to stroke, because when oxygenated blood doesn't get to the brain, it can lead to anything. Now, the next one is heart diseases, which make the heart and brain, okay, more vulnerable to complications. Like, seriously, a lot of people have a lot of heart issues, they don't even check most of the time. Maybe sometimes you're laughing and then you get this hook on the side of your of your ribs. Okay, when you're maybe you're laughing or you're talking, you get this hook up, on the side of your ribs. You begin to take it lightly. You feel like it's normal. It has been happening to me for a very long time. Ladies and gentlemen, it's a sign of cardiac. This is a sign of cardiac. It's not to be taken lightly. Go to the doctor, go for checkup, and let them give you the advice what you're to do and the medication. If there's medication for it, I'm sure there is. Yeah, there is the medication for it. Take your medications. When stroke occurs, okay, is because the blood vessel, okay, in the brain is either blocked by a clot. All right, and now it cuts off oxygenated blood from getting to the brain, which leads to uh, potential disability or even death. Yeah, people really die out of it. It kills people, and it's a serious medical emergency. Okay, but the good news is that many of these strokes are preventable. Now, living with diabetes, okay, don't you don't have to living with diabetes, you don't have to be powerless, okay, against against this risk, okay. Now, making small but consistent lifestyle change can significantly lower your risk of having a stroke. And here's how. Now, monitor your blood sugar regularly. Aim at keeping it at a healthy range as recommended by your doctor. Now, then the next one is check your blood pressure often. And if it's elevated, work with your healthcare team to manage it. You see, people taking blood pressure likely, okay, is one of the reasons why people all of a sudden some things attack them unaware. Nothing comes unaware. It has been giving them signs over time, but they feel like it's in malaria symptoms, so they just go to the nearest pharmacy shop, get malaria drugs, or they don't bother to check their BP, their blood pressure. They don't bother to check it, and the thing comes, and they feel like it's village people. It's not it's not village people or anything. It has been giving you signs, but you refuse to 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 acknowledge it. Now, eat a balanced diet that's low in unhealthy fats. Okay, like, so, unhealthy fat. You have salt, like salt, yeah, excessive intake of salt, sugar, but rich in whole grain. Okay, and then lean proteins. Take a lot of vegetables. To maintain a healthy weight and lower cholesterol. Regularly, okay, exercise regularly, even if it's 30 minutes walk, 30 minute jogging, 30 minutes walk, jogging, every day, each day. Just be consistent with it, okay. And movement strengthens your heart and lower blood pressures, okay, and improves overall health. And then go to get enough sleep. Get enough. A lot of people don't sleep. And if you want all the money in the world, you've been thinking a lot. There are problems you can solve. Okay, there are a lot of problems you can solve. Some problems will generally will resolve by itself. Okay, I'm not saying don't plan, but get enough sleep. Try get enough sleep. As quality rest, okay, help regulate your body's system. You get that, and provides energy you need for. I mean, energy you need to stay active. You need a lot of sleep and you need a lot of rest also. Okay, now limit salt intakes, okay, to keep blood pressure in check. A lot of people cannot do without taking salt. After cooking the food or the soup, they want to add salt to the soup that has been prepared. Stop it. You need to stop it. Now, maintain a healthy weight, especially focusing on reducing belly fat. Actually, I'm going to talk about how to reduce belly fat in my next video. How to reduce belly fat, I'll talk about it in my next video, but focus more, okay, on reducing belly fat, especially, like, seriously, which is linked to higher stroke risk. Belly fat, and people who have big belly or heavy weight, it takes time for them to recover from stroke most of the time, okay. And then the next one is quit smoking. Okay, quit smoking or using tobacco products. Very important. quit smoking. Okay, as they damage blood vessels, and increasing the likelihood of clot formation. The smoking or taking out of tobacco products together, they damage the blood vessels a lot. I know somebody was saying, I've been smoking for 30 years, I've been smoking for 35 years, and I've been okay. That person should go for scanning. Let's see what happens. The person should go for scan, or try to go for some checkup, and let's see if the person is actually healthy. You get that? Even the people selling the tobacco, they tell you that all smokers are liable to die young. Yeah, somebody is smoking at 70 plus years. The person know what he's living with. You might also start and say somebody is has been smoking for 40 years, nothing happened to the person. Systems of the body differ. What these people eat differs. You don't compare yourself. All right, the next one is take prescribed medications. Okay, prescribe medication consistently and as directed by your doctors. Okay, never skip a dose. There are some drugs you must not skip for a very long period of time. Okay, make sure you don't skip, and take your drugs and be consistent with it. Okay, in conclusion, with diabetes, okay, doesn't mean you have to live in fear. Yeah, you don't have to live in fear, okay, of stroke. By understanding the risk and taking proactive steps, you can protect your health. Okay, you can protect your health, and lead a fulfilled life, or fulfilling life. Okay, let me put it that way. Remember, small changes add up. Small changes, add up. So start with one or two adjustments and build from there. Your health is your most valuable asset. Okay, so don't wait until it's too late to take actions. Okay, learn how to safeguard your brain, your heart, and your overall well-being. Okay, and if you found this content very helpful, please don't forget to like, share, and comment.